Good morning, everyone, and welcome everyone to Data DIY's official kickoff, this four-part educational series. I'm Christian Rubio, your host and program director for Data DIY, and VP of Community Development and Digital Engagement at Global Genes. I just want to welcome everyone online as well who's watching the live stream of this program. We're really proud and excited to kick off the series with the whys and hows of data collection. We set out to really kind of engage this community after years of feedback of patients and patient advocates expressing their frustrations and their stories of what it was like to not only collect their data to share their stories with their clinicians, but also the need to actually establish some sort of plan to take more control of their research destiny when it came to trying to drive progress in rare disease research and drug and therapy development. So I just wanted to start off with really explaining kind of the basics of workbook one of day one of this series, and it really starts with the big why. Why we need patient data to drive research for outcomes, and then of course who values this data for their role in the health landscape, and how we can do more to exert our collective will to keep access to our data and take more control. So this educational series was designed to be interactive throughout the programs. So there's an open webpage that you can use. That's datadiy.cnf.io, where you can ask questions. First, you'll see the series of sessions that are available today, and each one of those sessions allows you to either ask a question directly of our mentors and speakers, or to upvote other people's questions. So please, throughout the program, feel free to ask your questions, and we'll work through them. If we don't get to your question today, or if you see the program on demand, please make sure you reach out to Global Genes and member support and member services, and we'll make sure you are taken care of. Speaking of the Global Genes team and the team behind Data DIY, I'm going to briefly turn the mic over to two people who've been wonderful catalysts and teammates for this program from Global Genes and Chan Zuckerberg Initiative, Nicole Boyce and Heidi Bjornson-Pinnell.
You did a great job with my name. Thank you, Christian. Are we ready to go? For those of you that were here earlier, that's my theme song by Republica, just FYI. Hi to the remote audience. Welcome, everybody. This has been something that has been in the works with an amazing new partner and partner to the rare disease community, Chan Zuckerberg Initiative. And we're so honored to be partnering with them on what I said has been kind of a long time coming. And it's so neat to see the amazing progress that's been made. I know we talked about this last night with what we think is a very forward-thinking, very much needed educational forum for patient advocates that are concerned kind of about what's next. Global Genes has always really focused on patients being drivers. We've been talking about that for the last 5 years. Working to equip you all to go out there and be drivers and leaders in all things related to the disease that you care about. And we believe that this series, this four-part series, is going to be critical in helping everyone ready themselves as a community to be partners in clinical care, in discovery, and obviously in research. So we have an amazing agenda that has been put together by an extraordinary team, Christian, Frida, and Pam, and the patient advocate leaders that you'll be hearing from will be sharing so many best practices, and we just think that you will be blown away by how extraordinary the energy and the knowledge in the room will be. So thank you to everyone for being here. Heidi, we're so grateful to have you.
Thank you, Nicole. I'm here with Chan Zuckerberg Initiative. My name is Heidi Bjornson-Pinnell. I'm the patient engagement strategist. I also have my colleague Samantha Scovener here. She heads our tech piece in our rare disease program. Chan Zuckerberg Initiative was founded on the birth of Mark Zuckerberg and Priscilla Chan's daughter. And one of the goals that they announced initially was to help cure, prevent, and manage all disease by the end of the century. That's a huge goal to try to reach for, and we're very excited about it. As we all know, there's over 7,000 rare diseases. Most of them are seriously underfunded, underrepresented. There's a huge lack of research in the vast majority of them. And we're really excited to try to help resolve some of those inequities and drive progress against rare disease alongside you. Data is critical to progress in research, and so we're super excited to be partnering with Global Genes, and you've done an amazing job. We're really excited.
Thank you. So let's kick this off. Let's go, team. Enjoy your day.
Thank you, Nicole and Heidi. The agenda for today breaks down really into two main parts. In the morning here, we'll be talking really about the why of data collection strategy and how it needs to be a part of your advocacy plan from the get-go, and really start out with a great story, the compelling story of Luke Rosen's KIF1A organization and what they've done in their collaborations and building the movement around the research. And then get into a little bit more of a deep dive with a panel of speakers who really share a kind of the different perspectives of folks who are working together to drive that collaboration. And really, the second part of the day is, as we often hear, think with the goal in mind, think long term. There's a lot of advice out there that doesn't necessarily get you off the ground. So we want to get into the hows. So the speakers are going to be back with us in the afternoon to really get into that and get into their lessons learned, because they've walked these miles in your shoes as well. And close out the day with the live stream component with really the building blocks of your first steps and your next steps, getting well structured for you. There is, of course, the live day component for folks in-house that we encourage folks who are watching from home or wherever they are to consider future dates to attend, because there is some direct mentorship. It's the reason we call our speakers mentors, is because they are peers. And they will be joining the folks in the audience for kind of self-assessment reflections and thinking about their respective strategies as individuals or leaders of organizations, stewarding people's data and talking amongst themselves about what their next steps may be. So speaking of our mentors and speakers, I just want to call them all out there. Amazing people, and we're so proud to have them, from researchers and clinicians like Scott Demarest and Ethan Perlstein, to really expert research strategists like Liz Horn and Steve Roberts, and innovative, passionate leaders like Luke Rosen and Megan O'Boyle and Kari Rosbeck. We really wanted to get the collective experience together and have them kind of riff when needed, but also tell their stories in their own voice as well. It's something that at Global Genes we're really proud to be able to support all the time, is the development of your storytelling. And we really believe that each and every one of you can do it just as well, and that's the goal of this program, is make sure everybody comes out of this program feeling like and knowing that they can take these same steps. So just a little bit of introduction, because there is this workbook that is available that we want people really using, engaging, using it as an interactive piece. For those at home, of course, it's downloadable. You can order from us a printed version as well if you prefer. And the key concept here, first and foremost, is that we want you to understand and make sure that you know at all times that your health data is yours, whether it's in your hands or as it travels across the healthcare landscape, it's yours. And it will take permutations. It'll exist in different ways. So, whether it's in the hands of healthcare providers that you're engaging in conversation with and you're making shared decision making in the best of times, or you're simply, having tough conversations about what's next, it's that data. The better the data, the clearer the data, the more you have control of that data, the better chances you have of better outcomes with them. Those healthcare providers work with medical experts to aggregate that data and to start making bigger decisions about it. And of course, insurance companies and payers, they're all about data. So if they're going to be studying the data all the time, making decisions about how your coverage is going to work and at what cost, you're going to have to advocate as well as you can, and your organization has to as well, to make sure that you make the best case possible with them in mind. Data also travels through the landscape in a larger level in those same hospitals where the care providers are, and turn into outcomes. And those outcomes talk dollars, or whatever currency you care to think in terms of. And there are incentives in play that ladder up to government policy and support services and all the other components of any disease, but especially in rare diseases, that at the core start with how well you steward your data and allow that data to travel. Finally, and maybe most poignantly in today's sessions, we're going to talk a lot about how that data lives and where it's reposited, or how that data can be stored, both with you as a patient or a patient advocate, but also how it's shared with researchers and how it's built with researchers, and how pharmaceutical companies and biotech companies can take interest and collaborate. But most importantly, as we move forward, that you never really lose sight or lose control of the destiny of that data, so that you can continue to make sure that the research doesn't get interrupted because of funding changes, that it doesn't disappear when a trial fails. Negative data being just as important, negative data being the data that goes away with a failed trial, for instance, or failed science, that doesn't leave your grasp either.